Think of like abduction here, flexion and extension going here. Then you swing your partner against you down. Okay, so, but what we have is the scapula, the ribs are curved, right? So the scapula kind of sits on an angle. So the plane of the scapula is not direct abduction, it's not forward flexion. The plane of the scapula is actually in this like 45-degree in between them, because it's somewhat rotated forward. And that plane, as she rolls her arm around, that scapula actually rotates with it. So if we're going to do kind of a relaxed test within the plane of the scapula, then we want to do something in this 45-degree motion. And you'll see that term throughout your time through us and then eval and then rehab for sure. Because we'll do things within the plane of the scapula. You just need to understand that its scaption is talking about this stabilization in this position. All right, with the arm at 45 degrees. Your empty can test will be there. You'll see it here and there. So, and he's going to show you a couple other glenohumeral radial muscle tests.
Okay, so abduction for the shoulder. So have the partner seated. Again, what muscles do abduction or at the glenohumeral joint? You guys remember? Deltoid. Okay. And there's like one other one that kind of contributes. Abduction. Supraspinatus helps a little bit. Yeah. So what you want to do is just apply the resistance, stable right here, and then just push down. You can do a brake test just like we have been doing. So rolling, push down. There you go. Well, when you're dealing with somehow. Okay, so
what muscles?
deltoids and then supraspinatus. Yeah, a little bit of supraspinatus.
When is supraspinatus most activated? Is it? So when is the supraspinatus used the most? What range of motion? So we keep lumping it with rotator cuff, but we've talked about it before to where it's not in that plane of the scapula. It doesn't have much line of pull to do any rotation because it goes straight over the top. So what does it do? All right, it's your about first 15 degrees of abduction. So it's not much, but it initiates that abduction, and then your deltoids takes over and does most of the rest of the work. Now your supraspinatus, once you're internally rotated, will be an external rotator. So eccentrically, when we get into like throwing mechanisms, it becomes largely activated to slow down that internal rotation. But either way, supraspinatus as a rotator cuff muscle really does the majority of its work in the first 15 degrees or so of abduction. And then deltoids take over from there because they're much stronger.
And then we also have horizontal abduction. And the best way you can do is if you have your partner on the table, on their stomach, kind of like what we were doing earlier. And then, first, what's the motion of horizontal ABE? What does that entail? Horizontal, and then am I going like this or am I going like that? Abduction. Back. Okay, so what muscles are involved in that? You think about it.
Deltoids.
Well, we're acting at the glenohumeral joint. That's what we're thinking about. What'd you say?
The posterior deltoid.
Yeah, it's going to be mainly posterior deltoid and a little bit of your external rotator. So like teres minor and infra. But again, like Reed said, it'll just be in that first 15 degrees too. So you can have them like that and have them pull back like that and then don't let me push it. And then you can do that. But you can also do it where they're setting up too. So they're pulling back. Yeah. Yeah, just like that.
So this is glenohumeral abduction, horizontal abduction,
Yeah.
right? But it's also the same test as what did we just do that it looks a whole lot like this?
what we just did. Depression.
It was no.
This test here, coming straight back. Adduction, adduction, scapular adduction, but it's glenohumeral horizontal abduction. So there's lots of terms going on to make sure that you kind of keep that stuff in order. We're trying to see that the scapula can pull that the muscle can pull the scapula back to the midline. But then we're looking at posterior deltoid strength to abduct it away, to horizontally abduct it. So don't get yourself confused, but they overlap in terms of how we're doing this. Now our focus here is not so much on having that hand placement around the scapula. We want to make sure it's stable, but we really want to see that scapular motion, so the glenohumeral motion. All right? I would encourage you to use your book to go through so you have a good feeling for other radial muscle tests to get some of the large fibers. As you study them, figure out what they're doing.